recognize the honourable member for Dartmouth North.
Madam Speaker, late last night, under the cover of darkness, government members discussed at length the mounting concerns about this government's approach, or proposed new approach, to the disclosure of personal health information, which physicians have warned will fundamentally change the nature of the patient-doctor relationship and potentially break people's trust in their physicians by allowing unrestricted disclosure of deeply private information. Can the Minister of Health and Wellness explain what is so important that requires this government to play with fire with our personal information?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. And as I said yesterday, there are already requirements in place for the Minister of Health that individual has to meet under the Personal Health Information Act already. This is about getting information in the hands of Nova Scotians so that they can have their records in their hands. They can navigate the healthcare system. We have seen this to be hugely successful in other jurisdictions. We have a responsibility to manage the healthcare system. We receive aggregate data from our hospitals, from our clinics, from all over, but we don't have aggregate data from our primary care. And that's what this is about. Managing a system, managing it well, managing it appropriately, and giving people access to their patient records.
The honourable member for Dartmouth North.
Madam Speaker, the government has indicated that these changes are needed to advance the work of the Your Health NS app. Has anyone heard of that app, by the way? Which in part is being run by an Ontario-based company that was awarded this work in an untendered $50 million 5-year contract last year. It's recently come to light that this company has been facing financial challenges and was recently acquired by an investment firm. Last week in estimates, I asked the minister about the sale and was told by the minister that the contract would be assumed by the buyer. Can the minister confirm, has anyone from the department been in contact with the new owner of people's private health information? And what does all this mean for Nova Scotia's health data?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. And I want to assure Nova Scotians that we are absolutely in compliance with all of the privacy laws that are in place. We want people to have access to their health records. We want people to be able to be their advocates in the healthcare system. People are asking, we hear all the time from the feedback on the app, we want more. We want to know where our records are. We want to know what our blood work says. We want to know about our diagnostic imaging. People are asking for this information. And through this legislation and through the work that's happening with Nova Scotia Health and a number of individuals who are responsible for privacy to support us in granting that request, there is nothing to fear for Nova Scotians.